Yes, Lagos, it is that time where we get to talk about your health, 15 minutes. Well, now the time the clock has switched or me, yes. It's now 16 minutes gone past five. You tune in to Smooth Health here on Smooth 98.1. It is your weekly reminder that a healthier you is a happier you. And today, well, talking before I get into the topic for today, November is World Diabetes Month, and this year's theme for diabetes is diabetes across the life course, and it's a powerful reminder that diabetes can affect absolutely anyone from a teenager who's just trying to figure out their diet to an older adult who's also trying to stay active and well. So tonight we're going to be taking a closer look at how to live well if you have diabetes, and also talk about some interesting facts where diabetes is concerned. And joining me to share great insight is Dr. Clement Aransiola. He is the consultant endocrinologist at Iwosan Lagoon Hospitals. So good evening, Dr. Olukayode. I'm glad to have you with me this evening.
Thanks for having me. Good
All
evening,
right.
Joyce.
Awesome, awesome. Lagos, don't forget you two also are part of the conversation, in case you were wondering. So yes, like I said, we'll be talking about how we can live well with diabetes across every stage of life. And hey, it's important for us to get into this conversation or talk about these things because the way I see when I see certain things, it just makes me wonder if we truly are on the right path. And here's let's even start simple. Let's start simple. What exactly is diabetes, and how do type 1, type 2, and gestational diabetes actually differ? I think we should start off from there and work ourselves up, or work our way up rather.
Oh, so thank you for the brief introduction. And then I will go straight to what diabetes is. It might be a bit confusing for those who are not science
Medical.
oriented, but
Okay.
but
Okay.
I can also go further to break it down.
Right.
Diabetes is just a group of disorders that affect glucose metabolism
Okay.
and is characterized by hyperglycemia. So the key word is there is glucose metabolism, which has to do with how our body process glucose, which is like the end product of the food that we eat.
Right.
Especially
Right.
the carbohydrates is broken down into glucose and some other things. And it's the glucose that is absorbed into the bloodstream. So in diabetes, what you have is a disorder, is a group of disorders where due to either absolute insulin deficiency or relative insulin deficiency or insulin resistance,
Right.
as the case may be, you have a high blood sugar, which is not controlled, which is out of control. And that is what is called hyperglycemia. And
Okay.
then going to the types of diabetes, the WHO classified diabetes into 4 major types. So the ones that we see like on a day-to-day basis are the type 1, the type 2, and the gestational diabetes mellitus. Now going to the type 1 diabetes mellitus is about 5 to 10% of the total number of people having diabetes, or percentage, about 5 to 10% of diabetes, generally speaking. So that is type 1 diabetes. And it's a condition where there's absolute insulin deficiency. That means the individual pancreas is no longer producing insulin. In which case, the only available treatment is to use exogenous insulin, or insulin that are produced by the pharmaceutical companies.
Oh, okay.
So the individual has to survive on that. And that is commoner in children. And it has like autoimmune basis. There is autoimmune destruction of the the individual pancreas. The pancreas is the organ that produces the insulin, and insulin
Right.
is the hormone that regulates blood sugar after food. And even when we're not eating, our body is secreting
It's
insulin to
still
make sure
true.
that the blood sugar is well controlled. So that's type 1 diabetes, commoner in younger people, but we've
Okay.
seen instances where even adults develop type 1 diabetes.
Okay.
However, it's commoner
In
in
younger.
pediatric age,
Mm,
adolescent, and young adults. Going
okay.
to type 2 diabetes, that is the type of diabetes that is rooted in lifestyle, as in our daily choices, our choice of food, our choice of whether we are going to, our decision whether to exercise or not, our
Right.
decision whether to snack or not, and some other things. So type 2 diabetes, the most potent risk factor for developing type 2 diabetes is actually obesity. And type 2 diabetes occurs in about 90% of all types of diabetes. So
Mm.
the greater problem that we have with diabetes is due to increasing number of people, either young adults, teenagers, adults, and even the elderly ones developing type 2 diabetes. Type 2 diabetes is common now as from 60 years of age and above. So
Okay.
the third type of diabetes is gestational diabetes mellitus. That occurs in pregnant women,
Right.
especially in the third trimester of pregnancy. These are people that have
Oh,
not had diabetes before the
okay.
pregnancy.
Right.
But due to some hormones that are producing pregnancy, some women develop diabetes after part of the pregnancy. And then diabetes is diabetes, either it's type 1 or type 2 or type 3. It has
It's
to be
just your body.
managed. Yeah.
Right. Right.
That, that has to be managed. So, but the thing about gestational diabetes is after delivery, the woman is no longer pregnant,
Mm-hmm.
and the placenta is out, the baby
Right.
is out.
Right.
So the individual can go back to normal, what we call normal glycemia,
Lifestyle.
normal blood glucose
Ah, okay.
for years, but they have a higher chance of developing type 2 diabetes in the future. So
Ooh.
anybody with a history of gestational diabetes mellitus has to keep on checking their blood glucose and living a healthy lifestyle.
Now we'll know, especially for the women, because when you see these things, you think, oh, okay, after that, I'm done, I'm good, I'm back to normal, I can eat anything. But it's, as they say, it's later in the future that it gets to affect, or you get to see these things play out. So, thank you so much for that insight. But now you spoke a lot about children or about the young ones having diabetes. And truly, in Nigeria, we're seeing more young people living with diabetes. What could be the cause? Is it the lifestyle? Is it what we're eating? What really are the reasons behind this?
Yeah, you got it. Those are just the main reasons. The truth is that we have moved towards the Western lifestyle.
Lifestyle.
Um,
Hmm.
at a point in time, I think almost all of us are guilty of wanting to belong,
Yeah,
as in
don't.
going to fast food joints. I could recollect the first time, I think I was an undergraduate in 100 or 200 level in University of Ibadan when Mr. Biggs came to Nigeria. So So I had a friend who is a banker, he started earning well ahead of me. So he invited me to Lagos and took me to Mr. Biggs on Adeniran Ogunsoya. That is in Bode Thomas.
Ah, okay.
So I really felt on top of the world. We went in and had, the ambience, everything looked so great.
Yeah.
So it was something to look forward to. So, but those things, unknowingly to most of us, are really making our children getting fatter, getting no, they are not being nourished because most of the fast food we have, like even bread, cake.
Right.
They are not nutritious. They are just empty calories. These are including the soft drink. All these
Oh
things.
yes. So that is one of the culprits.
Yeah. So all these things have a way of making people to begin to accumulate weight, excess weight, especially around
Midsection.
the midsection. Yeah, that is it. So once you start having abdominal obesity, there is a higher chance that those fats are also deposited in the visceral space and also in organs like the liver and the pancreas that are very key to managing blood glucose. They are part of the body's mechanism for regulating blood glucose. Because after a meal, the insulin pushes the glucose into your liver for storage as glycogen, which you can use when you're fasting. Insulin also pushes it into the muscle, which you can burn as you are moving along. So when you have sedentary lifestyle, people are not exercising. Okay, look at the kind of schools we have in Lagos.
Right.
Yeah, most of them are just buildings with no open field where kids could
They can
play.
actually run around.
Can run around, yes. So all this contribute to the high percent or high number of people getting diabetic in this age and time.
Okay.
So I think lifestyle that has to do with our diet, whether we are sedentary, whether we are physically active, has contributed a lot to the young people developing diabetes.
Okay, but for working adults, some are either stuck in traffic, stuck behind the desk. How can they manage diabetes, especially with the long hours, stress, and irregular meals? I am on this table. You see, when you say irregular meals, sometimes you get to eat once a day, and you're like, "Oh my days, I'm eating for for the entire day," and it feels like you've eaten for the entire week because of the timing, the scheduling, and all that. So how can that work? What do we do for the nine
Yeah,
to fivers?
thank you, Joy, for this particular question. It's a very important one. Indeed, the sub theme for this year World Diabetes Day. Tomorrow, November 14th, is World Diabetes Day. So
Right.
luckily for us, we started earlier.
We started early, yes.
so the sub theme is diabetes and the workplace. There are responsibilities for employers of labor. There are responsibilities for employees, but the employees' responsibility comes first, in the sense that as an employee, you need to know your rights.
Okay.
There is a Disability Act of 2018 in Nigeria, which prohibits any form of discrimination against people with diabetes from working or from being discriminated against at work. So, diabetes mellitus is classified as an invisible disability. It's not open. So until you come out to tell your employer, maybe your manager, that, okay, I'm suffering from this condition, your manager might not be culpable. If, for example, you collapse at work because of low blood sugar, after taking your medication, maybe you've not eaten. So you need to come open as someone who has diabetes and is working. Tell your manager, okay, I have this condition. I will need flexibility around my schedule, around meal times. So when you are taking time off work to go and eat, or maybe to find a space to inject your insulin or take your tablet, your manager already know that this is what this individual is doing.
Right.
You also need to come out to fellow
workers
and tell
your colleagues,
yeah, and tell them that, okay, I have this condition. In case anything goes wrong with me, okay, for example, you can help me check my blood sugar and correct hypos if need be. So things like that. On the part of the employers, they must accommodate the individual as in provide a flexible schedule of work.
Yeah.
And they must provide emergency kits, rooms where people can go in to take their medications, and so many other things.
All right. All right, we have a quick breather coming through. Let's take it. When we get back in, we'll also touch on management, especially when it comes to the medication. Some people say it's so expensive trying to manage their diabetes, either the insulin, test kits, all that. Then we'll talk about how people also, how it can affect one's mental health. Mental health is something that is on the front burner this day, so we need to touch on that as well. But we'll talk about that when we get back in. Lagos, don't move a muscle. Stay glued to your radio. Smooth 98.1. So it's a quick break, and then we'll be back in. Very quick.
Are you planning to hop on a plane to visit family or friends?
But when it comes to the medication part, I see a lot of people try to get those local substitutes. They'll tell you, somebody's selling one agbo somewhere and they've tried it, or they'll tell them to drink so and so things. It will flush it. Does it really, as someone who's a medical professional, how do you deal with people who come up with all these theories?
Yeah, it's a big body because people are looking for a quick fix. People are looking for like a cure for diabetes. You know, the unfortunate thing for diabetes is at a point, for most people, it's not even curable.
Right.
It's a very small number that can really be reversed if it was detected early and if it's type 2 diabetes or maybe gestational diabetes mellitus. So even the most educated people around, they just want one herbal medicine that can want a magic or a silver bullet that can be the solution to diabetes. So I don't blame them because it's a very stressful condition to deal with. Imagine you are in traffic, you are thinking of, oh, is my blood sugar too high or it's too low? Or when am I taking my next medication and all that? So the part of the issue with managing diabetes in Nigeria is the difficulty with getting access to quality treatment. Because in Nigeria, most of our patients pay
from Lagos
out of pocket. So in a country where the minimum wage is 70,000 naira, or the national minimum wage is 70,000 naira,
start your amazing journey.
You know, most people with diabetes, they have multiple medications. The one for cholesterol, the one for blood pressure, the one for the blood sugar. And for the blood sugar, some individuals are even on 2 or 3 drugs. So you can see that one of the drugs, if you take one of the drugs, 30 tablets, it will be 30,000 naira for just a
Yes.
So that's why we need we need health insurance, universal health coverage for every Nigerian, so that at least people can do some contribution and have access to healthcare.
My game changer. It's really important to have that universal healthcare, and hopefully put something more in place, because it really eats into some people's savings, just into their pockets, having to always buy medication every other day. If you take for this month, what happens the next month? And it comes with, it's not just diabetes. If you don't manage it properly, there are other underlying ailments that will also creep up on you. So it's
you're very right. So it's a very difficult situation. That's why a lot of people don't comply with their drugs. Some resort to herbal medications because they are poor, they can't get the right care. Some resort to praying about it.
I'm sorry, I'm laughing, but
Yeah,
even the
that is
Bible does. Even the Bible does tell you that all prayer without works is dead. So he gave the doctors this knowledge. So hey, we need to put things in proper perspective.
Yeah, thank you.
All right, let's get back in. All right, Lagos, it is 36 minutes gone past 5. You are tuned in to Smooth 98.1. My name is Joy Ure. And on Smooth Health today, we're talking about how you can live well with diabetes across every stage of life. And I have Dr. Olukayode with me, who's been giving great insights, by the way. He's the consultant endocrinologist at Iwosan Lagoon Hospital. Before we went on that quick breather, we're talking about how one can manage their diabetes. This time, let's talk about the medication angle. What can people do if they're finding it hard to keep up with their treatment costs?
Yeah, that brings us to the issue of health insurance.
Okay.
For example, at Iwosan Lagoon Hospital, a vast majority of our patients are on health insurance. We have private patients, but they are not as much. The private patient pay a lot of money.
Oof.
But health insurance is just a fraction of what the private pay. For example, for consultation, when they come to see the doctor, it's just a fraction. Maybe patient will pay. So what I have seen in Lagos is a lot of people that have jobs.
Your
also have one insurance or the other by the employer,
the
which
audio
can
on your
cater
end
for
isn't clear.
most of the larger the is it better now?
Yes, it is better. So I'd like you to reiterate what you were saying, talking about insurance.
Okay, so what I was trying to say is that at Iwosan Lagoon Hospital, the large percentage of patients are on health insurance. So because of that, caring for a patient is not as difficult as what I had experienced elsewhere in a government hospital. Because most times when you write the drug, even the cheapest drug, these days we have some of the best pharmaceuticals for managing diabetes. In fact, we're in the golden era. Now and then you have cutting edge drugs or medications being produced by the big pharma just to manage diabetes. So, but some of the drugs are way out of the reach of an average.
Yeah.
Drugs that may be an injection that somebody takes once a week to manage diabetes. You know, you can be talking about maybe 400,000 to 500,000 for just a month cost of that. So I think the way forward is to ensure that people have one form of health insurance or the other. I think some states are involved in health insurance, like Lagos State. That's what they call Iwosan Eko, if I'm not wrong. In Lasuth, they do that. In Oyo State, where I used to reside, they also have like
a means of insurance.
Insurance for the informal market, for the informal to access healthcare at a
reasonably cheaper rate.
So without insurance, there's no because so health insurance is very key to managing diabetes and other chronic diseases going forward. It's something that government has to step in and ensure that every Nigeria is covered. Because diabetes is, like you mentioned, there are so many complications that can develop from this disease that is not even, it's just unthinkable. For example,
Honestly.
diabetes is the commonest cause of chronic renal failure or chronic kidney disease if it's not well managed.
Right.
So that if you are going to add that, the cost from complications on top of the cost for regular management, it will just be maybe somebody that is a billionaire that can that can afford to manage this.
That's a very scary situation to ever want to find yourself in. But let's talk about something that is also important for those who haven't been diagnosed. What are the signs that they need to look out for? Uh, people will say, "Oh, I'm fine," until they are not fine.
Yeah,
Because,
I'm
so what
fine
are the signs?
until they are not fine. That is the best way to say it. Now, the unfortunate thing about diabetes is that most of the people having a lot of the people having the disease have not, even more than 50% of the people having the disease have not been diagnosed. So if I say like maybe 1 out of 2 is diagnosed, that is just maybe an international estimate. It may be in places like US, UK, where they are really, so most of the things that we do here, as in the figures that we bandy around as the number of people suffering from diabetes, they are not really from like
Well placed research.
exactly, not from like a national survey or people living with chronic diseases or something like that. It just maybe
A random sampling.
and what they call it, and this kind of study that you pull data from different
Ah,
small studies. That is the
and
kind
that's
of
not enough to actually give details or, know how many people
yeah,
are actually living
yes, that is the
with
figure we have
particular.
from small studies that are put together, and then you report it. So well, quite a lot of people don't have, and that's why on World Diabetes Day we try to screen people, free screening that will be available in the Iwosan Lagoon Hospital for everyone, staff, outsiders, anybody that wants to check. Anybody that is above 40, even if you are not from a family with diabetes, you should be able to do your blood sugar checks at least once a year. That fasting blood sugar is not expensive. Even
Okay.
in big hospitals, by the time you spend 1 to 1,500 naira, you'll be able to check your blood sugar. So the thing is that some individual might have an acute symptoms. Acute symptoms of diabetes will include things like passing excessive urination, excessive thirst, weight loss. Maybe people are having boils or candida infection for women. Some even an infection that has been dormant, like TB, tuberculosis, could be
Okay.
reactivated. So
Ouch.
is the symptoms are those are for the acute symptoms. But like
Mm.
I said, a lot of people don't have symptoms. It's just some they might have developed complications before they even know that they have diabetes. For example, a man developing erectile dysfunction.
Ah, okay.
Yes. And he comes to the hospital and the doctor says, okay, go and do your blood sugar. And
Mhm.
it's confirmed that he now has
That's
diabetes.
why. Right.
So, and the damage is already done at that stage. So I'd seen a patient before that the first educated woman, Tisha, who the first presentation of her diabetes was having a gangrenous foot.
Ooh.
She never knew that she had diabetes. She never checked, and she's well educated with well-to-do children. Because I with time she almost became a family because I really felt sorry for her when her leg was amputated. Her children
Ouch.
were doing very well, and even when some of our children came back to Nigeria, they are living in in a posh environment here in Lagos where they housed her. You understand? So this happened while I was working in Ibadan. So it's just what we see. So the good thing is that at least with programs like this, a lot of people will get the awareness that they need to check their blood sugar. And for people that are overweight or obese, once your BMI is more than 25, that is overweight. 25 to like 29.9, that is overweight. 30 and above is obesity. So now, if you are falling to a BMI of 25 and above, you need to conscious and you're about 35 years and you have never done your blood sugar before, you need to do so. You need to check your blood sugar. It can be done. You can walk to any clinic where they have the point of care device, the glucometer.
All right.
So then anybody with who has risk factors, who have people who have risk factors like family history of diabetes, past history of gestational diabetes, and people having sedentary lifestyle, and a host of even African Americans, you need to, even if you are less than 35 and you are overweight or obese, you need to check your blood glucose.
Oh, okay. So it's something one needs to check regularly.
Yes.
Okay. That is a whole lot of insights that has been shared this evening. Thank you so much, Dr. Olukayode, for your time and knowledge shared. How can not just Lagosians, how can anyone reach out to you to get possibly have access to free testing to know if they have if they have diabetes or any other questions that they might have? What is the social media handle that they can reach out to ask all these questions?
Yeah. We in Iwosan Lagoon Hospital, we have the diabetes support group, which is headed by Dr. Bright, who is a family physician at Idejo. So in any of our centers, you could reach out to Mr. Dari, that is our head of marketing.
Okay.
Or in any of our centers, like tomorrow, we are going to be screening people either at Adeni Jones or Awolowo Way, 97 Awolowo Way or 91 Adeni Jones Avenue, Ikeja. And I believe our other facility across the group will also do so. So it's free. You can come around and check your blood sugar and your blood pressure. So because diabetes is not just the disease of blood sugar alone.
Right.
And most people with diabetes also have hypertension. They have what we call dyslipidemia, abnormal cholesterol.
Okay.
And then some of them already have complications like kidney disease and the rest. So all these things have to be managed.
Okay. All right. Thank you so much for sharing all this insights. And Lagos, that is how we draw a curtain today on Smooth Health. It is important to make sure that you're checking yourself regularly. Do not take anything to chance. Don't say, okay, I'm healthy. Remember, get screened. So, and also, yes, one thing the doctor said is we need to eat mindfully and exercise. It's important. That way you stay alive and healthy. That's how we draw a curtain today on Smooth Health Lagos. There's still so much lined up for your listening pleasure. So don't move a muscle.